Next, we need to perform the pre-use checklist before hooking the Versal vent up to the patient. The Versal vent, as we have mentioned before, has two gas sources, air and oxygen. We need to ensure that we both have enough air and oxygen for the duration of the treatment. Refer to the manual to see how much air and oxygen is needed for the duration of the treatment. The Versal vent requires 80 psig air and oxygen pressure to properly function. The air source in that pressure will show us how much what the pressure for the air source is. Currently, we're at a minimum of 80 psig, which is correct. Also, for our oxygen, we need a minimum of 80. Our gauge is showing that we have 80 psig. That is correct. Now that we've determined we have enough gas supply for the duration of the treatment and the gas supply pressure is sufficient, we need to energize the system by turning the three-way valve up towards the green line or oxygen line. This is what is going to deliver the tidal volume to the patient. If you turn it towards the air line, it will be delivering air to the patient. So we want to ensure it is pointing towards the oxygen line. Next, we need to turn on the toggle switch by pushing it down or up. Now that the Versal vent is energized and cycling, we need to listen for any abnormal sounds and confirm that there is no leaking and all our connections are secure. As it's cycling, I do not hear any leaking, and I've checked my connections. All of them seem to be tight and secure. I'm also listening for any abnormal sounds coming from inside the ventilator. It seems to be cycling normally. The sound you're currently hearing in the ventilator is not abnormal. It is the tidal volume being delivered to the patient from the time cycling block. Next, we can utilize a digital accelerometer, or you could use the right spirometer to determine the rate and tidal volume for the case. If the physician prescribed a breathing rate of 15 breaths per minute and a tidal volume of 500 milliliters or 500 cc's per breath, we need to go ahead and set that now before hooking it up to the patient. So we can adjust our rate again by pushing in on the sleeve and turning the inspiratory time to the right or to the left, also with our expiratory time. And then if we need to adjust our tidal volume, we can adjust it with the tidal volume knob. So currently, if I'm desiring 500 milliliters per breath, I'm currently at 520. I can slightly decrease my tidal volume knob until I get to my desired setting. Let it cycle a few times to ensure that the tidal volume and rate is where you want to be. So next we need to set our peak inspiratory pressure. To do this, you can hold your thumb to occlude the flow to put back pressure, or you can use a test lung. If the physician prescribed a PIP of 50, all we need to do is hold down the test lung to get our pressure high enough, and then we can turn our overpressure relief valve counterclockwise until it pops off at 50 centimeters of water. Okay, now it's popping off at 50. We can release the test lung. Now that we've achieved our desired settings for this case, the Versal vent is now ready to use.